Thank you, Dr. Ankita, Dr. Vaidehi, Amphat, and Sahani sir. Good evening, good
Thank
afternoon,
you, sir.
good morning. This is the 1487th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Rajneesh Kumar Sharma. We welcome all to this session. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day from 7:30 to 8:30, the Hindi session, 8:30 to 9:30, the international session in English, and 9:30 to 10:30, our local language session in Malayalam. All the sessions are going in a good way, and we are uploading the sessions on the very next day itself on the YouTube. So those who want to watch it again and again can subscribe IFPH Homeopathy. So that is the channel through which you can watch our IFPH programs on the previous videos also. Let me introduce the guest of the day. It is none other than Dr. Rajneesh Kumar Sharma. Sir has completed BSc, BHMS, MBBS, MD in Homeopathy, TA in Homeopathy from London, MD from UK, D.Lit from UK, and PhD. Sir is a privileged executive member, Delhi Homeopathic Medical Association, life member, Homeopathic Medical Association of India, life member, Indian Institute of Homeopathic Physician, life member, Indian Medical Legal and Ethic Association, Medical Examiner, Life Corporation of India, faculty to several national and international conferences, and recipient of many international and national awards. Executive Director, Handyman in Homeopathy Sandesh, a peer-reviewed journal, author of numerous research papers, articles, case presentation, and books. And sir is the Chief Managing Director, HomeoCure and Research Institute, Vaibhava Homeopathy Pharma, and Spurs Multi-Speciality Hospital. So we proudly welcome our guest of the day, Dr. Rajneesh Kumar Sharma. Oh, sir. You can begin the session, sir. You are the co-host now.
Thank you very much, sir. Thank you for giving the privilege to express my views on sleep positions in terms of homeopathy. Already, I have described the sleep position in Hindi last days, and on demand, and I'm presenting in the English session with some amendments and some additions in the slides. Let me share my slide.
Yes, sir. Sleep position and homeopathy. Visible, sir.
Thank you. Without losing time, I'm just starting the session and coming to the point directly. The sleep positions and homeopathy. Everybody knows what is sleep. The definition of sleep in books, that is very typical, but I have compiled in a simple language. Sleep may be defined as a periodic state of rest accompanied by varying degrees of unconsciousness and relative inactivity. This definition is not available in any text, in anywhere, but this is the extract of the several definitions of the sleep in simple language. This is a periodic stage of rest and varying degrees of unconsciousness and relative inactivity. Several people become unconscious, they sleep like a comatose patient, they sleep like that. And some patients, they sleep in very superficial sleep. They do not have deep sleep, and they are awakened very easily. They are having very shallow sleep. This is the period of relative inactivity, and this is excited by Sora and syphilis. There is great individual variation in the amount and depth of the sleep. This depends on person to person, stage to stage, sex, and the age of the patient. The sleep-wake cycle varies in relation to the age and gender of the individual. Women past age 35 tend to sleep more than a man. You can see the ladies in your house, they get sleep in the daytime also. They have short sleeps at periodic intervals. Whenever they get time, they used to go to sleep for a minute, for 15 minutes, for 10 minutes. This is applicable to the women of the past age 35. The newborns used to sleep 20 hours each day approximately. The child 10 hours per day approximately. Adults 6 to 7 hours, and elderly they used to sleep 5 to 6.5 hours each day. As the age advances, the need of sleep that decreases. Sleep has two stages: rapid eye movement sleep and non-rapid eye movement sleep. In non-rapid eye movement sleep, we used to move. We do not use to move our eyelids, and in rapid eye movement, our eyes used to move to and fro under the eyelids. NREM sleep, this is the synchronized sleep, and it involves the 4 stages. In non-rapid eye movement, there are 4 stages. Stage 1, when eye movements become very slow. And if we perform an EEG during this stage 1 of the NREM sleep, the EEG shows low brain activity. We become sluggish, mentally sluggish. In stage 2, the EEG activities increase slightly with the appearance of spikes. These spikes are called K complexes. You can see in stage 1, the brain sleeps, it becomes more silent, and in stage 2, it reactivates. In stage 3, eye movement ceases and wave frequency in EEG that is reduced, but amplitude is because frequency and amplitude are inversely proportional. The frequency is reduced, then amplitude is increased in the waves of the EEG. It performed in stage 3 of the non-rapid eye sleep. In stage 4, EEG shows more delta activity, brain goes to sleep, and there is appearance of delta waves in EEG, and it shows the person is sleeping in a deep sleep without movement of any eye. In rapid eye movement sleep, this is also called dreaming sleep. Whenever our eyes are moving under the lids, this is the rapid eye movement sleep, and this is often accompanied by dreams. This phase of sleep is characterized by appearance of dreams. Deprivation of REM sleep may cause anxiety. Whenever a person is aroused during rapid eye movement sleep, he becomes very anxious, irritable, develops migraine, headache, hangovers, and so on. This may lead to overeating and hypersexuality also, with the effect of pseudosora, and psychosis may arise. The rapid eye movement or REM sleep, it affects the sleep. The effects of sleep deprivation are reversed when normal sleep wake cycle is resumed. Whenever a person is awakened from rapid eye movement, so-called kachi sleep, raw sleep, he becomes irritable, more anxious, voluminous, and hypersexual. Whenever he resumes a normal sleep cycle, he becomes absolutely normal again. This is a reversible condition. These non-rapid eye movement or NREM and REM rapid eye movement sleep, they alternate during each night. Each cycle requires 90 minutes to 100 minutes time to complete the cycle of REM and NREM sleeps. NREM sleep composes about 75% of the sleep cycle, while the rapid eye movement sleep constitutes 25% of the sleep cycle, with variations among various individuals depending on sex, time, environment, and age of the individual. Thus, the sleep cycle constitutes REM plus NREM. Okay. NREM sleep composes the 75% of the sleep cycle, and REM sleep composes the 25% of the sleep cycle to have a complete sleep. These alternate one by one. There are certain physiological changes during sleep. In general, we can say the LH hormone secretion increases during sleep in pubescent boys and girls. This is also under effect of psora and psychosis. The secretion of prolactin also increases in men and women, especially immediately after the onset of the sleep. As soon as the person goes to sleep, the prolactin secretion increases. This is also under effect of psora and psychosis. The waving of the hands, the swinging of the arms, laughing, and flatus passing. These normally occur during sleep. These are the normal phenomena during sleep. There are certain physiological changes during non-rapid eye movement sleep, that is sympathetic change. First of all, we must discuss some sympathetic change. During early stages of NREM sleep, especially in stage 1 and stage 2. In stage 1, the brain sleeps, and in stage 2, it awakens slightly. The sympathetic activity decreases. There are two types of the activity, sympathetic and parasympathetic. In sympathetic changes, during NREM sleep, in starting of the stage 1 and 2, the sympathetic activity decreases. Therefore, there is gradual slowdown of the heart rate. There is lowering of the blood pressure, and there the respiratory rate becomes more regular. In dreaming state, the respiratory rate becomes irregular. But in this NREM sleep, non-rapid eye movement sleep, the respiratory rate becomes smooth, more regular, and it may decrease slightly. This is the true stage of rest. In NREM sleep, there are certain parasympathetic changes also. Parasympathetic activity tends to dominate during deeper stages of NREM sleep during stage 3 and 4. The heart rate and blood pressure continue to decrease. They are fallen down. The GI activity, it may decrease as well. The digestion becomes slow. The movement of the intestine and the stomach and the peristalsis becomes very slow. Everything is sluggish in this sleep, and the person is in the true relaxed stage. This is a time of recovery of the losses of the body. There are certain autonomic changes during non-rapid eye movement sleep. The body temperature tends to fall. We feel chilliness because there is loss of temperature. The temperature becomes low due to lowering of the basal metabolic rate during NREM sleep, especially stage 4. We need to cover up the body. The body undergoes physiological changes associated with repair and growth. I have already told in this page there is the process of repair and growth of the body. Therefore, this is very necessary stage of sleep. Now, we have to discuss rapid eye movement sleep, the sympathetic changes. This is the reverse condition. REM sleep is characterized by increase in sympathetic activity. In non-rapid eye movement, there was decrease in sympathetic activity, but in REM sleep, there is increase in sympathetic activity, which may lead to increase in the heart rate, increase of the blood pressure, and arrhythmic respiration, and increase in the respiratory rate also. The temperature of the body, it also rises in this stage. This is the just reverse of the NREM sleep. As far as parasympathetic changes during REM sleep is concerned, this activity is not completely absent during an REM sleep, but it tends to be less dominant than NREM sleep. This is less dominant. The parasympathetic changes are less dominant than NREM sleep. Some reports suggest an increase in gastric activity during REM sleep. In NREM sleep, there was sluggishness, or like just stoppage of the gastrointestinal activity. But in rapid eye movement sleep, there is increased gastric activity. We become more awakened, more active in this phase, and there is activity of passing the flatus, the eructations during sleep. In general automatic changes during REM sleep or rapid eye movement sleep, brain activity that is similar to the waking state. Though the person is sleeping, eyes are moving under the eyelids. This is rapid eye movement sleep. The brain activity is similar to the waking stage. It's just like an awakened person, and therefore he used to see vivid dreams. The body is sleeping, but mind is not sleeping, and the activity of mind is the activity of brain is development of the dreams. The body may experience temporary muscle paralysis to prevent acting out of the dreams. This is called sleep paralysis. Why this occurs? Because body is just sleeping and mind or brain is not sleeping. The brain is active and developing the state of dreams. In dreams, the person acts as a hero or actor of the theme. Therefore, he may start acting like a real entity, real activity, and may use to move the limbs, move the body, or move the whole human to the ground. He may start talking, he may start laughing, He may start moving the hands or acting like whatever the request, and he may used to walk in deep sleep, the stage of somnambulism. This is the process of development of the somnambulism, which is compensated by temporary paralysis during sleep. The muscles are paralyzed, this so-called sleep paralysis, so that the person may not act like a waking state in the dreams. This is to prevent the somnambulism. Normal sleep is very essential. If we are not going to sleep normally, certain diseases may develop. I will discuss in later slides. During sleep stage, whether REM or NREM, especially in rapid eye movement sleep, there occurs snoring. Snoring is induced by sora, psychosis, and pseudosora. It is clinically insignificant, but it may develop apnea, sleep apnea, which can be very harmful, and the consequences are very hazardous. The consequences of loss of sleep may include fatigue, loss of concentration, difficulty in coping of jobs, job performance, behavioral activities, daily routine activities may be hampered. Therefore, the loss of sleep may develop a number of consequences. Most people feel and perform best with 6 to 8 hours of the sleep each night. If you are sleeping 6 to 8 hours in deep sleep, with all the cycles, REM and NREM cycles completed, you will feel better and healthy. There are certain bad effects of insomnia I will discuss in later slides also. The persons deprived of sleep for several days or more become irritable, fatigued, unable to concentrate, and may become disoriented under effect of sora and causa occasionalis. Causa occasionalis because there is loss of sleep which can be controlled, but we are not controlling the loss of sleep, and that the consequences are developing. This is the loss of sleep is the cause, therefore causa occasionalis word is used here. The performance of mental and physical tasks deteriorates with loss of sleep. Some individuals experience paranoid thoughts and auditory or visual or tactile illusions or hallucination. They may experience somebody is sleeping inside, sleeping aside, somebody is sitting on the chest, somebody is hurting or hitting, somebody is biting, somebody is befooling or laughing upon the sleeping person. Certain time, he may talk to imaginary persons, he may see ghosts, phantom thoughts, bizarre thoughts may develop, and he may develop the stages like similar to schizophrenia or a number of disorders or phobia. Now, the main topic, which is the sleep position, I will come to that particular topic. There are several ways to people, the people used to sleep in routine life. These characteristic sleep positions may reflect their inner personality. If we can identify what the sleep position correctly and interpret it, we can conclude, we can diagnose the personality of the person. Preferred sleep position might hold the key to unlocking aspects of characters of the person. His sleep posture can offer interesting insights into the traits and tendency. If we can learn the traits, tendency, and personality, we can diagnose the person's individualized characteristics. We may diagnose the constitution and may approach the constitutional analysis with analysis of remedies, and we can find the constitutional remedy for that particular person with the act of sleep position. Now, I'm going to describe the first sleeping position. This is the fetal position. You can see the individual is lying on the side and the he's curled up with legs tucked in. This is the condition position, just like fetus inside the womb. Therefore, this is called fetus condition. This is a very common condition. If we analyze the personality of these persons, they are initially very shy, but after mixing up, they become quickly sensitive at heart and silent. The most common sleeping position, the fetal position, and more common in females. The females used to sleep in this position more than the men, and this is also common in babies. There are certain remedies which can be prescribed to such type of fetal condition sleeping patients. For the individuals, there are Capticium, Paratacar, and Murcor. These three remedies and several other remedies may be also, but I have selected these three remedies which are mainly indicated for this type of fetal positions in during sleep. These are baptisia, parata, and mudport. Another position is log position. The individual is lying on the side and he has straight legs and arms aside. He is sleeping in the one side, left or right, any side, with this straight legs and the arms aside. This is log position. This type of persons, they are sociable persons, they are very easygoing persons, and possibly gullible persons. They are innocent and they trust others very easily. They are very soft and very nice persons. The remedies for log position individuals may be phosphorus, arsenic album, and lycopodium. I have selected these three remedies only, but several other remedies are also there. But these are the king remedies: phosphorus, arsenic album, and lycopodium. We can study the matter in different books. I am not going to discuss in detail into fixed types. The another position is ulnar position. The individual is lying on the side and arms are stretched in the front. The individual is lying inside with arm stretched out in the front. This is a very common position. This is found especially in women. These are open-minded persons but are very suspicious ones. They take their decision very slowly, very late, but their decisions are very firm. They are very firm decision maker persons of suspicious nature, but with open mind. The remedies for this type of personality are lycopodium, ammonium carbonate, mercury, sulfur, and several others. Another position, that is soldier position. You can see the lady, she is lying straight on back with arms straight down, just like the position, the Savdhan position. This type of persons are quiet, they are reserved persons, they have very high standards of life for oneself and as well as others. They respect themselves and they respect others also, and their living standard is very high. The remedies indicated are sulfur, digitalis, abrotenum, and glycyrrhiza glabra. Glycyrrhiza glabra is a very good remedy prescribed on basis of this soldier position. Recently, I prescribed glycyrrhiza glabra to a lady which was sleeping in this position, and several complaints they vanished. I was also surprised. The complaints she didn't know, she revealed next time, sir, I was having these troubles also, but these are also cured. Another position is free fall position. The individual is lying on the belly of abdomen and hands are around the pillow. You can see the picture. The individual lying on the belly of abdomen with hands around the pillow. This is the free fall position. These persons are very social, but they are impatient. They are secretly nervous and they are very sensitive to criticism. If you analyze these symptoms, social, impatient, nervous, sensitive to criticism, certain remedies appear in the repertorization, and we can select the remedies which are sleeping on the abdomen. These are pulse, aloes, belladonna, colosynthis, nux vomica, arsenic album, copulus indicus, ignitia, platinum, and so on. This position is very good for digestion. You can see the remedy: pulse, the digestion remedy; aloes, the remedy for digestion; colosynth, the remedy for digestion; nux vomica, arsenic. These are the remedy for copulus. These are the remedies which are commonly indicated for digestive troubles, but these remedies are only selected after repertorization with maintenance and sleep position. Another position is starfish position. The individual is lying on back, legs are stretched out, and hands are raised by the head. You can see this is a starfish position. The individual is occupying whole bed with legs and both arms. This type of individuals are very loyal friends. They are very loyal persons. Not seeking attention. They do not seek your attention. They do their own, and they are very impatient listener. They do not want to listen for a long time, but they are very loyal friends. This position may lead to snoring and bad night sleep. This position, because hands are raised, the neck muscle or the platysma, etc., are stretched over, and they put the pressure on the larynx, and snoring is supported. This type of starfish position leads to bad position of the sleep and develops snoring. The remedies are pulsatilla, rustox, lux vomica, chamomilla, platina, rhododendron, viola, adurata, etc. Recently, there is a case. He was developing sleep apnea and with a history of snoring for several years. For sleep apnea, he was treated by some other doctors and undergone sleep analysis, sleep study. A number of investigations were done, but sleep apnea was not controlled. And he was prescribed a device which was put in the nose to clip the nose, and that was relieving the patient somewhat. The single dose of, you will not believe, the single dose of rhododendron, the clue was a starfish sleep position and pain in joints, history of joint pain, which was aggravated during cloudy weather or thunderstorm. The rhododendron single dose was just cured the sleep apnea of the patient. The snoring disappeared. There is again a position which is hybrid position, soldier starfish position. Two positions are combined here. These sleepers resemble soldier or starfish during sleep. Sometimes they used to put their arms straight, and sometimes on abdomen and under the head. They sleep on the back, but do not give the rigidity of soldier, because they often move the hands under over the chest, under the head, or over the pillows. This is a hybrid condition. This type of person are very flexible persons. They are easygoing persons, and they can be easily persuaded. And of course, they can persuade others also. This position may lead to snoring and bad night sleep, because such type of position is not good. The stretching of the arms is not good for larynx or trachea. The remedies indicated for this condition are arsenic metallicum, arsenic album, carcinosin, tetramers. You can see these all the remedies are very fastidious. They need cleanliness, and all the four remedies are weak remedies. The person is very active, but it gives up the energy very quickly and becomes very weak suddenly. Another position is pillow hugger position. Any sleep position, any one position in which the pillow is hugged, this is known as pillow hugger position. Such type of persons, which are pillow hugging persons, they value their relationships. They are people pleaser persons, and there is a lineup of bonds and relationship. They used to bond very deeply and very tightly and very strongly with others. They value the relationships. The remedy is phosphorus, because this is the nature of mesmerism, affection, and attracting the people. Another sleep position, this is snorer position. Any sleep position where which is accompanied with snoring is known as snorer position. These are expressive persons, they are passionate persons, and they are prone to extreme emotions. The remedies for these persons are indicated like anacardium, telegraphos, china, graphitis, iosamus, ignitia, acid pure, omica, opium, silesia, estrimonia, etc. There are several other remedies also. Another position is two-way position. Whenever individual sleeps on in any position and keeps one limb out of the two-way, arm or leg, this is known as two-way position. Such type of persons are relaxed in nature. They are carefree persons, and they are open to experiences. They learn very easily, and they try to catch the different experiences, and they are very good persons. and these persons are comfort seeking persons. आराम बड़ी चीज है, ये बड़ा चैन से रहना चाहते हैं. These are very comfort seeking person. The remedies are coning, platinum. Both remedies are indicated in this condition. A case was there. There was a child. He was keeping a leg outside the doorway in severe cold weather also, and and used to catch cold very frequently due to uncovering of the limbs in sleep position. And that very baby was fond of very dashing clothes, clean clothes, dashing dress, irons, and some kada and that and bangles. The remedy was platina for that particular baby, and he was cured within a few doses in a couple of weeks. Another sleep position is prostrate and worship position. This is similar to free faller position. The individual is sleeping on abdomen, and the arms are under the pillow, and pillow is under the chin. Each individuals are often conservative. They desire control, and they have difficulty in unexpected events. They are not ready for unexpected events like medullary, carcinosis, hypotonium, fever planning, syndrome, and several others. You can see there are certain remedies, medullary, these two remedies are permissible remedies as indicated in figures. There is another position known as human position. This is similar to the soldier position. The individual sleeps like soldier, and he is sleeping on the own. He does not care for anybody during sleep. These persons are very self-confident. These are open-minded, and creative persons are there. They always feel happy and easy to control one's manner. They are the person who can control others and himself also. The remedies are another remedy, you can see the remedy directly. This is a criminal position. The individual sleeps with legs, ankles locked onto one another. The ankles are locked to one another. This is the cross leg position, and this is known as criminal position. These individuals are hindered by inner thoughts. They are very anxious, brooding persons, and they are this brooding nature is reflective of worries because they used to move their feet during sleep. The single remedy is there, rodent. Another sleep position is lion position, sleeping lion position. The individual tries to sleep, but he is unable to sleep, and the sleep refuses that person. This is the sleeping lion person. The person is struggling with falling asleep, and he is conscious, wanting to remain alert. The remedy for sleeping lion position, you can see there is sign of some cerebral or meningeal irritation because the individual is not going to sleep due to some trouble inside the brain. This is the condition where the pathological changes are there in meninges or brain. The indicated remedy you can see helliborus, paragrania, lactases. These are very typical remedies for meningitis and hydrocephalus also. While these associations between sleep position and personality traits are fascinating, it is important to note the individual preferences and comfort play a significant role in sleep position. The sleep depends on environment, age, sex, lifestyle, way of living, environment. Some persons used to sleep in very dark, they switch off all the lights, and some person used to sleep in bright lights. Some person used to sleep in red light, some in blue light, some in green light, some in candles, and several modes of sleeping position are there. Some individuals used to sleep in closed rooms. Some individual need open windows. Some individual need cooling of the AC, but some need cooling of the AC along with the fan on. There are several conditions with the comfort, the selection of the pillow. Sometimes the pillow is tight, or pillow is hard, or pillow is soft. The sleep may be disturbed. This depends on the nature and the taste of the individual, which type of mattress or which type of pillow he is using. Suppose if individual is shifted to another side of the bed in his own bedroom, the sleep may be disturbed. Sleep depends on several environmental factors also. There are certain disorders which are induced by poor sleep. Homeopathic remedies I will discuss in these slides. You can see the sleep deprivation results into very anxious state, irritable state, or a number of disorders. I will discuss a few. Insomnia. What is insomnia? Insomnia is a difficulty falling asleep or staying asleep. The person is not able to fall into sleep, or if he goes to sleep, the sleep disturbs and he awakens frequently. This is also type of insomnia. The insomnia can lead to chronic fatigue, anxiety, and depression. There are certain remedies for this type of insomnia, which are coffea cruda. Coffea cruda, you know, this is indicated due to excitement or racing of the thoughts in the brain during sleep. Another remedy is nux vomica. This is due to insomnia due to stress, overwork. Text businessman, he often has insomnia of nux vomica type. And use of excessive stimulants, the perfumes, the wine, the whiskey, and spices and rich food, this can induce the insomnia. The remedy becomes nux vomica. Another remedy is passiflora, which is helpful in calming the nervous system to induce a sleep. Passiflora slows down the acetylcholine receptors and person becomes sluggish and muscles become relaxed, partially paralyzed, and person may go to sleep due to inactivity of the body. Another condition is sleep apnea. I have discussed partially in previous slides. Interrupted breathing during sleep leading to daytime fatigue and cardiovascular issues in sleep apnea. The certain remedies indicated for sleep apnea may be opium, laurus, carboveg, etc. Opium is for sleep disorders with heavy snoring with breathlessness. This is a very characteristic condition of the sleep apnea, and the opium becomes a remedy. Another one is a laurus. Here there is difficulty in breathing during sleep. Another remedy may be carboveg, which is indicated during hypoxic conditions. It helps in oxygenation and it relieves the symptoms of suffocation because of the carboveg patient becomes feels to be hypoxic, and carboveg is a remedy which increases the oxygen level in the body, just like aspidospirmia in case of COPDs and pneumonias. There is another condition which is induced due to loss of sleep, that is narcolepsy. Excessive daytime sleepiness. The individual is sitting in the chamber, he is sitting in the shop, he is engaged with some important work, and he is attacked by sleep attacks. This is very common condition. Some individuals used to go to sleep while sitting, while talking to others. This is the narcolepsy. The remedies for narcolepsy are Agaricus muscarius. This is indicated for excessive sleepiness and lack of focus. The individual is doing some certain task and he is unable to focus on that particular task with excessive sleepiness, then Agaricus is the remedy. There was a case a few months ago. The individual was a doctor, a colleague, and he was seeing a patient. He was just palpating the abdomen and he went into sleep during sitting, and patient was his known. The patient used to remain in same condition for at least 15 minutes till the doctor awakens again. And he told, doctor, you got to went to sleep when you were palpating my abdomen, and I was just waiting when you are coming out of sleep, when you are getting awakened, and 15 minutes have passed. He was laughing, and doctor feels very ashamed and contacted me because this particular episode was repeatedly appeared for 3 or 4 times. I prescribed a gelsemium for this overwhelming sleepiness with muscle weakness because he was just sleeping and the head was stooped down during the palpation of the patient. Gelsemium, a 2 months course was given calcium 200 once a week, and he was cured completely. I will not tell the name of the doctor. Another remedy is Nux mosquito. This is the remedy where narcolepsy is there. The individual uses to go to sleep during apps in the daytime, but he is very confused and drowsy, and the drowsiness increases especially after eating. Whenever he eats anything, especially meals, he cannot resist the sleepiness and goes to sleep in any posture, sitting in any position. There is another condition which is restless leg syndrome. Whenever the individual goes to sleep, the legs become painful and restless, and he has to move the legs continuously. And this restlessness symptoms prevent the sleep, and this is caused by lack of sleep. This is the Carnot cycle, and both the cycle are not going to. They are hindering the cure of the condition. They are developing the condition worse. Uncontrollable urge to move the legs during sleep is known as RLS. There are certain homeopathic remedies which can be prescribed. The king remedy you all know. The remedy for restless leg syndrome is Ginkgo metallicum. Especially at night, the individual uses to move the legs during sleep. There are restless feet. Often, this restless feet condition is seen in uremic patient. Whenever there is a condition of chronic renal failure, restless leg syndrome may appear in those individuals also. You must be cautious. For restless leg syndrome, we must go for blood test whether the kidney is involved or not. Another remedy is Restrox. Whenever restlessness in leg is there, but this is accompanied by twitching of the muscles, then Restrox is the remedy. In Ginkgo mat, there is no twitching in legs during night. There is only restlessness, but in Restrox, there is twitching of the muscles also. Another remedy is arsenic alba, which has restless leg like Ginkgo metallicum, but there is burning sensation also. Whenever plain restlessness is there, Ginkgo is the remedy. Twitching is there accompanying, Restrox is the remedy. And with restlessness of the legs, if there is a burning sensation, arsenic album is the remedy. Another outcome of the loss of sleep is chronic fatigue syndrome. This is very commonly seen in individuals. The day becomes very fatigued. The individual says, I feel tired every time. You can see in TV ads, you need certain type of vitamins. There are ads in TV also. You can see this condition can be developed by chronic loss of sleep. This is the condition with extreme fatigue, which is not relieved by rest, and is often linked to poor sleep. The homeopathic remedy for this chronic fatigue syndrome may be phosphoric acid, arnica montana, and gelsemium. You can see phosphoric acid. Whenever there is exhaustion of the physical or mental conditions, physical and mental exhaustion that is seen in acid phos. When whole body aches and there is fatigue after over exertion of the limbs or body, the arnica montana is the remedy. When there is tiredness, which is of extreme nature, with heaviness of the limbs, the gelsemium is the remedy. Loss of sleep has a lot of impact on mental health also. It may cause depression, anxiety, swinging of the mood, and these can be exacerbated by lack of sleep and can be relieved by recovery of the normal sleep cycle individuals. The remedies: ignitia, aurum metallicum, galiphosphoric. Ignitia is the remedy for depression and sadness due to grief and emotional distress. You all know. Aurum met for severe depression with suicidal thoughts, and galiphos for mental exhaustion, nervousness, and insomnia. I was seeing a case about 4 months ago, and he was a PCS officer and was overtaxed. There was overburden of the job, and he developed sleeplessness due to overburden, and developed restless leg syndrome, headache, migraines, and some visual problems, sparkles, floaters around the eyes, and he consulted a number of doctors. He consulted ophthalmologist also, but nothing was found. Every test was normal. Nothing was seen in any sort of investigation or report. And he consulted me. I prescribed Nux Vomica with great failure. Nothing happened. The picture was very clear. He was having loss of sleep. He was having indigestion. He was having frequent urging to stool. He was very irritable. He was having burden of the job and the consequences of the over business tasks. Nux Vomica didn't relieve. And I studied the case again. He told, इससे तो मरना बेहतर है. This life is very tormenting and I may commit suicide. This is my thought. And I prescribed the Aurum metallicum on this basis, Aurum metallicum 10 in 1 dose. And that miraculously cured that case. Within 3 days, he came back to me. I prescribed for 7 days, but he consulted after 3 days only. And I was shocked. Something happened, but he was very happy. And he told he slept for 12 hours on first night, 10 hours on second night, and 8 hours on third night, and he was perfectly fit on third day, and he consulted with the expert of fluids. Thanks to homeopathy. There is another condition which is developed due to sleep loss. This is heart and blood pressure disorder. Poor sleep elevates the risk of heart disease, risk of hypertension, and stroke, and even diabetes. The remedies for this type of condition, if it is developing after sleep loss, are Crataegus oxycantha, Aconite, and Nux Vomica. Crataegus is for cardiac muscles. It is a myocardial tonic, and it is indicated in high blood pressure and heart issues. This is a very good remedy for that, and can be used as adjuvant to different type of constitutional drugs also. Aconite lepulis, sudden anxiety, high blood pressure, and that high blood pressure is due to fear. Whenever high blood pressure is due to anger, Nux Vomica may be there, or chamomilla may be there. Whenever high blood pressure is there due to sudden stroke, heat, the clonine is the remedy. Whenever the high blood pressure is due to sudden emotion or sudden environmental change, the amyl nitrosum is the remedy. Nux Vomica helps to relieve the hypertension caused by stress and overwork, which I discussed with failure in LPCS officer. The Nux Vomica didn't relieve in restless syndrome and the irritability and bowels, but Aurum metallicum. What is the outcome of this discussion? The improving of the sleep may increase the chances to become more healthier, and healthiest person. And it may be supported with homeopathy. The importance of sleep hygiene and homeopathic remedies I have to discuss here. Whenever a person is suffering from loss of sleep due to bad sleep position or any cause or environmental factor, he can accommodate in the same atmosphere. He can adapt, or he can change the atmosphere according to his need, and he may be supported with homeopathy remedy, which may be indicated according to their sleep positions or their other key symptoms. Practices for better sleep includes maintaining a regular schedule and avoiding stimulants before bed. Do not use stimulants or spicy food or rich food during sleep. The night meal should be very light so that sleep can be very easy and deep. Thank you. Thank you very much. This is the discussion on sleep positions, and in the next slides, next time I will discuss more and more diseases and will collect more data. Thank you for inviting me for this session. Thank you so much.
Thank you, Dr. Rajneesh Kumar Sharma, sir. It's really an excellent session. You really went up all part of the session, or what is sleep and how it improve and what are the conditions which make one sleeplessness and what are the remedies and how it acts on different situation. Anyway, that's the beauty of this presentation. The only thing was it was too speed, just like you are just going like 100-mile speed. Anyway, we can definitely watch it again in the YouTube so that we can understand something more in depth about your presentation. Really appreciate your enthusiasm and still practicing homeopathy even after getting MBBS. But there are people who always forget about homeopathy once they get MBBS and they go for some other specialization. But anyway, you stick on with homeopathy and you are doing excellent service to humanity by practicing homeopathy. What a great man, sir, you are. Thank you for your excellent session once again. I invite all of the participants to join in the discussion, and you can ask your questions as well as you can make your suggestions and your experience with the sleep also. So those who want to talk to Dr. Rajneesh Kumar sir, please raise your hands. I invite Dr. Remadevi Ambari to begin the session. Okay, please you can unmute yourself, and those who raise the hand can also be allotted. I think Dr. Ramparisa sir is ready. Okay, you can speak now, and then yes. Yes, yes.
Thank you, Dr. Dhaneji, and congratulations, Dr. Rajneesh Kumar Sharma. Very nice presentation.
Thank you, sir.
Excellent session. Position of sleep and disturb loss of sleep. Deals homeopathic medicine. Very good selection of homeopathic medicine.
Thank you, sir.
Very, very thanks.
I could talk because the session is too fast. Because I am I have to.
Yes.
I was have to. I was given the time up to 9:30, and I have to finish the session up to within 9:30, and I finished. This is the cause for this fast session.
Select homeopathic medicine, therapeutics, and mental disturbance due to loss of sleep. It is beauty of homeopathy. Very, very thanks, sir.
Thank you so much.
Very, very thanks.
The sleep, we used to say that observe the patient and prescribe the remedy. Where the sleep position is very, very important. I used to ask some of my patients the way the child lie down, and whether the patient is simply lying in the normal position, whether the patient is lying on the right side or the left side. There are patients who used to, for example, once I still remember a case of a phosphorus when the patient was asked to lie on the left side. Then he told me that I can't lie, but he was lying on the left side, only right side only. So in those conditions, the phosphorus was the remedy, and that works beautifully, and the patient was recovered very quickly. So in some other cases, we can see most of the pulse artery patients used to lie on abdomen. And in those cases, we can confirm the remedy in that way. And there are patients who used to say that I can lie only on left side like that. So the side is also important. The way, as we know that being the restless, being a Rustox being a restless patient, he used to utilize all part of the bread to lay them, just simply moving this right side, left side. So that can be another point of it. So I invited some other person, Dr. Yesh Kumar Gautam. You want to speak? Please unmute yourself and speak to sir. Yes, please unmute. If you yes, you can speak to.
Hello.
Yes.
Sir, is my voice is audible to all? Like,
Yes.
yes, sir. Good evening, sir.
Yes.
Sir, there are so many patients, and there are so many people who used to sleep irregularly. Like in the beginning of the sleep, they used to sleep in shoulders position, and in the middle of the sleep, they used to sleep in sonars position, and at the end, the position of the sleep is different. Then how will we select the remedy on the basis like?
Thank you for asking this question. I was expecting this question from any person, and I'm very happy you are asking this type of question. This is a hybrid condition. I discussed certain conditions which are having two type of the sleep position. But you are talking about three type of hybrid conditions. This reveals the instability of the patient. He is not stable. He is very changeable person, and you can easily go to pulsatilla. This shows the changeability of the person. He is not confined to the one position. I think it is clear to you as far as mental condition is concerned. As far as physical condition is concerned, he may have some physical problems, some pains, some stiffness in the body, then restlessness may be there, and due to restlessness, you can prescribe Rustrox.
Now we invite Dr. M.G. Geeta to have a talk, and you can say vote of thanks to the session also. Dr. M.G. Geeta. Yes, madam. Dr. M.G. Geeta. Please unmute yourself. Yes.
Good evening, all. So it is a very nice and an excellent section. Thank you, sir, very much for sharing your knowledge. Sir, I have a patient. She used to fall from her bed invariably once in every week. She used to turn always during sleep, turn to right side, left side, like that. She used to fall. What it indicates, sir?
The sleep position is very uncertain, and he is restless during sleep. As far as I am understanding your sentence.
Okay.
Am I correct?
Very restless.
Very restless.
Very restless.
We have to diagnose the cause behind the restlessness. What is the cause behind? The cause may be physical or cause may be mental. If mental restlessness is there, the remedies will be different.
She is mentally calm and quiet. She is on hypertensive drugs. That
may be due to causa generis. Certain antihypertensive sorts have tendency to develop such a type of restlessness. Especially tell me certain. At all, what these remedies used to develop the symptoms of restlessness. This may be causa generis.
So this restless leg syndrome, RLS, I found gelsemium is very effective.
Yeah.
I'm having a patient, she got very good result from gelsemium.
Yeah, this is very good. If especially when numbness or some type of weakness in the lips, it's very good.
Okay, sir. So anyway, very nice section. Thank you for sharing your knowledge, sir. Highly informative.
Thank you.
So it's a new topic, I think.
Yes, definitely.
It's always nobody else discussed it
so far.
So thank you very much, sir. I express my sincere thanks or gratitude to you, sir, on behalf of this IFPH and from my personal side. Thank you, sir.
Thank you.
Thank you very much, sir. Thank you.
Thank you, Dr. M.G. Geeta, madam. And she was also a professor from Government Homeopathic Medical College, Toronto. And just retired and now working as a in which college now is she?
Now I got retired from Government Homeopathic Medical College and working at White Memorial Homeopathic Medical College near Tamil Nadu, Martanda.
She's having more than 35 years of experience. Teaching
experience 30 years maximum I got.
Department of Pathology.
Pathology.
Her father was also a famous homeopathic doctor.
Okay, he's no more.
I'm much obliged. Thank you.
Thank you, sir. Thank you very much.
Thank you, Dr. M.G. Geeta and Dr. RAJNEEsh Kumar Sharma and those who participated in this session. And tomorrow we will have a session from Dr. Arpita Chakrabarti. So with that, we come to the end of the day, 1487. Thank you all and good night.
Thank you.